Officer, and Sarah McCall, Multnomah County Communicable Disease Nurse Manager. And with us to discuss the latest is Dr. Paul Cieslak. Sorry. Just a few reminders. Please make sure to include your media affiliation when you sign on, so we know that you are with the media. If you're not media, we just ask that you jump over to our YouTube link, and I think we will be putting that in the chat here if it's not there already. You can also view a recording of this media briefing on our website after we're done here at that same YouTube link. If you want to ask a question, we ask that you use the raise your hand function to be added to the queue, or feel free to drop a question in the chat and I'll ask your question on your behalf. Also, please mute your audio when you're not asking a question or when you're done asking a question. Lastly, we'll take one question at a time, and if you have any follow-up questions, we'll take it when everyone has had a chance to ask a question. And so with that, I will turn it over to Dr. Paul Cieslak.
Good afternoon, everyone. Well, the news is that despite being spared for the first several months of this year while outbreaks were raging in the rest of the United States, we now have our first case of measles in Oregon in 2025. And the reason we want to make this known to you is that we have significant numbers of unvaccinated people in the state of Oregon. When there's not measles around, the risk is very, very low. But when we have measles in the area, the risk really goes way up. And so it's important both for patients to understand, or for our residents to understand, that there is a risk of measles now in the area, and it's important for physicians to understand that they need to consider measles in any patient presenting with rash. The main thing that we want to ask the general public is that if you develop a rash illness, that you not simply drop in on your medical provider where you might expose other people. Measles is perhaps the most highly contagious disease that we know of. It's spread by the airborne route. Just breathing the air that someone else has coughed into who had measles is sufficient to transmit the infection. So don't just drop in, call your provider beforehand, let them know what you're concerned about, that you have a rash illness, whether or not you're vaccinated, whether or not you've been exposed, and arrange to be seen where you won't be exposing other patients. If the proper precautions are taken in the healthcare setting, we can really eliminate the risk of transmission. So I'll leave that as the introduction and invite questions.
Okay, thanks, Dr. Cieslak. So again, if you have any questions, please use the raise your hand function to be added to the queue, or drop your question in the chat and I'll ask your question for you. And it looks like we have a second here. We do have our first question from Ashley Blow with Lookout Eugene. Go ahead, Ashley.
Hi, thank you for having this press conference. I wanted to clarify, when you said risk in the area, was that specific to Portland Metro or a larger geographic area? And what does this mean for other counties and cities in Western Oregon?
Well, as far as we know, I mean, the one patient that we have arrived on the 17th of June, and anybody who's been exposed, it would have been in the Portland metro area. And we're aware of a couple of places where people may have been exposed. Number one is at the Portland airport, and number two is at the Safeway in Lake Oswego. And so those are really the areas that we know of that are at risk. And I don't know that there's risk right now beyond those areas.
Okay, thanks, Ashley. If there are any other questions, feel free to use the raise your hand function, or you can just drop your question in the chat. Don't see any other questions. We'll wait one more moment to see if any pop up. Oh, there is one, I think, from Ariel Salt. Go ahead, Ariel.
Hi, thank you so much for hosting this meeting with us today. So Oregon also has one of the highest vaccine exemption rates in the country. I believe it's the fourth. How does this possibly impact places like schools, daycares, places like that?
Right. Well, that is one of our concerns. And although I said that the case that we know about had limited exposures in the Portland metro area, certainly if anybody who is in one of those areas contracts measles, that person can, start a chain of transmission, and we may see more cases. And one of the issues with measles is that you're contagious before you even develop a rash. People are contagious from about 4 days before the development of the rash until 4 days after. Once people get a rash, they might stay at home and avoid exposing other people. But before that rash starts, they may be circulating in the community. And, that's where all these unvaccinated people are going to be at risk, is going to be from the person that they don't even know has measles, or the person may not even know himself that he has measles. Our kindergarten vaccine exemption rate is one of the highest in the country. I believe it's the second highest, and that puts a lot of people at risk within Oregon. So it's possible that we could see a lot of transmission and people move around quite a bit, and transmission that eventually extends outside the Portland metro area. The best prevention is vaccination. The recommended 2 doses are 97% protected.
Thanks, Ariel. Just a reminder that Dr. Bauman with Washington County and Sarah McCall with Multnomah County are here on the call to answer any questions you might have. And again, feel free to drop your question in the chat if you'd like me to ask a question on your behalf, or just use the raise your hand function. I don't know if Dr. Bauman or Sarah, if you have anything to add to what Dr. Cieslak said, but just open it up for any comments you might have. So.
I think one thing that this particular case brings up is the risk of measles exposure from travel. So it is certainly international travel that can expose people to measles, but recently you've certainly been hearing about outbreaks and cases across the country. So domestic travel can also put people at risk. From the public health perspective, we've certainly been receiving notifications about exposures on flights and in airports, and this is an example of that risk, and potentially bringing measles back into the home area. And because of this, public health is really encouraging people to check their vaccine records before any planned travel, and getting MMR, the measles vaccine, prior to travel.
Thanks, Dr. Bauman. Okay, and I did see that Ashley, did you have another question? I saw your hand was up for a bit there. So
yeah, Ariel really touched on my question. I just know in Linn County and Eugene and Springfield that I cover, there's just been a lot of concern about measles generally coming here. So I guess just if there's any other words of advice that people should be listening to during this time, especially when there's so much misinformation around.
I would just say if you're vaccinated, your risk is very, very low, even if you're exposed. And so the main concern is if you're not vaccinated, you're going to be at risk, and possibly from someone who doesn't seem to have measles, for all you know.
Thanks, Ashley. Ariel, did you have another question?
Yeah, I'm just gonna kind of rapid fire a handful of questions, because it seems like there's not as many questions, if that's okay.
Yeah, go for
it. So first, do we know where this person came from? Rough age range? Are we looking at a child, an adult? Do they live alone? Are the people that they do or do not live with exposed as well? And how are you all predicting the possible impact this could have this summer, with potentially more and more cases in the area?
I'll let I'll let the county folks discuss anything that they want to talk about regarding other exposures. I will say that you know, during the summer, it's really all going to depend whether anything takes off from the cases that do get introduced. We have cases introduced with some regularity, and you know, in general, they run into a lot of vaccinated people, and the disease doesn't go anywhere. But when it lands in a group of relatively unvaccinated people, it'll spread like wildfire. And so, you know, what our summer looks like is going to be dependent on what that happens, whether that happens.
Hey, this is Sarah, and I'll just reiterate, we don't believe there's any other exposures or risk to the public other than what's already been mentioned as the airport and Safeway. And as it was said in the press release, this is an adult.
Thank you. Appreciate it.
Thank you, Ariel. I am putting in the chat, by the way, OHA did send out a press release in March when there were questions about measles outbreaks from around the country. I just put that in the chat if you're interested. We do provide information on checking immunity status against measles and encouraging getting vaccinated if that's of use. So we encourage everyone to check their immunity status if they don't know. So
I'll just flesh that out and say, you know,
yeah, go ahead.
We consider you to be immune if you were born before 1957, when virtually everybody had measles, whether you realize it or not. If you've had laboratory confirmed measles yourself, if you've had a blood test showing that you have anti-measles antibodies, or if you've had 2 doses of vaccine, any one of those things, and we would consider you immune.
Thanks, Dr. Cieslak. Okay, wanted to just once again see if there are any other questions in the with the raise your hand function, or if you have questions you want to put in the chat, happy to ask for you. We'll just take a moment to see if there are any other questions, and I'll just if our speakers today have anything else that they'd like to add, to feel free to jump in. Okay, not seeing any questions. We may call this one early. So once again, thank you everyone for joining this media briefing. I want to thank Dr. Cieslak, Dr. Bauman, and Sarah McCall for being a part of this. Feel free to drop us an email at phd.communications@oha.oregon.gov. That's PhD as in Public Health Division .communications with an S at the end @oha.oregon.gov. And we're happy to take any follow-up questions.